Alright guys, in this video I'm going to be telling you exactly how the npte-pt or the physical therapy board exam is graded. Alright, so we'll go straight into it. The first thing is there are 250 questions. 200 questions are actually graded in the test that you are taking, and 50 of these questions are just like testing questions for the next year's NPTE or the year after. I think it's updated every 2 years. So the first thing you want to know is, what type of questions do they ask? They call these things items, and it's the way that the question is asked. You have a specific item that the question is asking about, and a stem, like the way that it kind of, the question develops. So if you're, one of the examples that's given in the Scorebuilders book that I'm using right now is, let's say you have a patient who has a Foley catheter that you have to take through ambulation exercises, right? Where would you have the bag? Where would you want to put the bag? And so the question would be, like, the item of the question is like Foley catheter, ambulation, and then like the stem is like, it's like Foley catheter, and the stem would be like ambulation, and where would you put the bag, like stuff like that. And then that moves into like the actual questions. So there are going to be 4 multiple choice questions. They're not going to do things like none of the above or all of the above or 1 and 2. They're all going to be distinct answers, and then you have to choose the best answer for it. So the answers for the example I just used would be like, do you want to place it above the bladder, below the bladder, above the patient's heart, or below the patient's heart, stuff like that. So from there you can kind of figure out, so the way that it's actually graded. So since you're using a 200 question raw score, so they'll take it, they'll put it in, out of 200, how many points did you get? There's a passing like level for that. So in the Scorebuilders book, it talks about how usually it fluctuates between like 135 and 145 depending on the governing body's decision on how difficult the questions were, which sections were more difficult than other sections, and stuff like that. They'll pick like, oh, this should be the passing score. So this weighted score is called the FSBT, criterion-based passing score. The governing body's decision on how difficult some of the questions were, they'll weight questions differently. And since this minimum passing score varies between tests, there's always a range that it moves between. So as I said, 135 to 145 could be kind of that range, just as an example. So let's just say, just for easy math, 150 out of 200. So you need at least a 75, right? So from there, they have to weight the scores, and they'll weight it in a way that under 600, so that'd be 600 to 800 is the top 25%. Under 600 you fail, and then above 600 you pass. So that's how they score it. So an 800 is a perfect score, and it doesn't mean you got 100%. I know the way that they weight it can be weird, but if you got an 800, boom. And then if you get above a 600, you pass. So it depends every year. The board kind of figures out how they want to weight the questions. That's how they score it. So they take 250 questions, 200 actually count to your score. They'll weight it, they'll figure out a percentage that they want you to pass at, they'll weight it, and then from there your actual weighted score will be in the hundreds, so up to 800.